And when people saw these things that were going to be our objectives, then they went ahead and signed our petition. And I want to thank all those that actually signed my petition for signing it and getting us on the ballot. Thank you very much.
All right, thank you, Mr. Bill. Now it's time for the questions. Just as a reminder, the person to whom a question is addressed will have 2 minutes to respond. The other candidates will have 1 minute to comment. And we'll start with the first question from Mr. Rust to Ms. Emerson.
Ms. Emerson, there have been a number of government bailouts in the past 2 years, along with the Obama stimulus plan. You voted for the Troubled Asset Relief Program, or TARP, but against most of the others. How would you rate the success of TARP, as well as the other government relief and stimulus plans?
Thank you for that question, John. Number one, let me say that when you, as a member of Congress, get a phone call from several community bankers in your district, and then you have small business people call and say, all of a sudden, I can't get any credit. And because of the banking system as it exists today, in order to have commercial paper to pay payrolls, in order to get money out of an ATM, in order to get paid, fact of the matter is that there was really no choice, in my opinion, and the opinion of both Republicans and Democrats in the Congress, to vote for the TARP, or the Troubled Asset Relief Program. And as a result of that, we have a lot of people who are yelling and screaming, shouldn't have voted for the bailout. And I would ask all of my opponents here, then what would you have done when faced with economic collapse in the United States of America? No commercial paper, no payrolls. Our senior citizens who live on fixed incomes suddenly lose all of that income because the stock market is going down and down and down. And then as a result, it was a very tough decision, and it was not a politically correct decision, but yet sometimes I think you have to be a leader and you have to make those tough decisions when the fate of the economy is at stake. With regard to the stimulus, I voted against it because the stimulus was in fact throwing money at problems and try to create jobs that really weren't job creating. We paid for people who were in job training. That counted as a job. Other than the small piece that was infrastructure, the rest of the stimulus, all it did was create 240,000 government jobs and about 9,000 private sector jobs. A big waste of taxpayer money.
Mr. Sowers, do you have a comment?
Yes, I've also spent a lot of time talking to community bankers that are opposed to the Wall Street bailout. I bank at Phelps County Bank, and last year its FDIC fees went up 20 times over the year before. So what the big bank bailout did was reward the bad actors in the economy. And Congresswoman Emerson is one of only 90 legislators to have voted for the big bank bailout and against the sort of regulations that we need to make sure that this doesn't happen again. When it comes to the idea that there would be no choice, I find that unacceptable. There were lots of choices along the way to not repeal, to not deregulate, to make sure that the loopholes that the large corporations have would be closed so that we wouldn't get to this point in the first place. So the fact that we have a legislator here saying that they had no choice to vote against a $780 billion bailout is unacceptable to me. With me, you're going to have somebody focusing on community banks first.
Mr. Van Dieven?
Yeah, TARP was sold to us on the fallacy that what is good for Wall Street is good for Main Street. Let's focus on what TARP did not do. It did not jumpstart consumer credit. That trend has not changed. It had no immediate impact on consumer confidence. It did nothing to boost the housing market or create jobs. I don't need a chart to show you that. Delinquent loans are still at an all-time high, and there are more taxing assets than ever. Fannie and Freddie have been delisted from the New York Stock Exchange and are now wards of the state. TARP was nothing but a low-interest loan to irresponsible financial industry. We won't know the full effects for years to come. Most importantly, TARP was another highly unpopular market manipulation by Washington that voters despise. and I will never forget.
Mr. Bill.
This gets back to where we need practical experience in Washington, D.C. If you ever had a fire, if you ever owned a hardware store and went out of business, the busiest time you would have been was the last week of your business. That's when the most customers would have showed up. These credit default swaps should have easily been all transferred over, figured out. Somebody would have come up short. There would have been some suits and those kind of things, but somebody else would have jumped in and actually bought that bad paper. But instead, what we did is we made the Bank of England, the Bank in Germany, AIG, Goldman Sachs, they all went whole, and we got left holding the bag. And what happened? We had to borrow $800 billion from the Chinese to bail out the big guys. And the small banks did not make these loans. The small banks knew the American consumer much better than the people that were selling the bonds on false ratings. And that's why I was against it.
All right, the next question will go to Mr. Sowers, and it will come from Mr. Smythe.
Thank you. Mr. Sowers, when President Obama's health care plan was working through the legislative process, you said that you would vote in favor of it. Recently, you have said that Obamacare needs to be changed, but not repealed. What would you change to or improve?
Well, it is clear that the final bill that passed was too big, too expensive, too complex. And the next Congress is going to be going there to fix and repeal portions of it. The only vote I casted on health care in the last 12 months was for Proposition C, because I disagree with the individual mandate. The question is now, who is best placed to fix and repeal portions of this bill? My approach in the campaign has been different. I've been out on the ground, talking with voters, working jobs alongside them. And so when I think of health care, I think of Jenny. Jenny I met down in the southern part of the district, and she gave a kidney to her child. And then the insurance companies dropped her because she had a pre-existing condition. I think of Travis, a small businessman who prior to any reform, his rates were going up 35% year over year over year, and he had to drop coverage. And I think of Jim, who runs a hospital in the Boot Heel, where prior to any reform, he would have had to have told his own employees at the hospital that he can't cover them and to go down to the emergency room. So the question is, who can best fix and repeal this? Congresswoman Emerson's experience is as an insurance lobbyist. She receives tens of thousands of dollars from the insurance lobby. Her idea of fixing and repealing this would put the insurance companies back in charge. And that's who she will have top of mind when it comes to fixing and repealing portions of this. Me, I'll have Jenny and Travis and Jim in mind. Thank you.
Mr. Van Dieven, a comment?
Yes. There is no panacea for the health care problem in this country. Health care will never be free, and there will never be enough. Here are 7 things that we can do to make health care more available and affordable. First and foremost, repeal the recent Health Care Act. Number 2, repeal the HMO Act of 1973. This is the act that takes the decision-making process away from the doctor and the patient and puts it into the hands of a third-party bureaucracy. Number 3, deregulate the insurance industry to allow competition across state lines. Number 4, dissolve the AMA's monopoly on medical licensing. Number 5, replace the FDA with a more agile, free market alternative. Number 6, make prescription drugs affordable by making all drugs available over the counter. And number 7, allow individuals to establish 100% tax-free, limitless medical savings accounts.
Mr. Bill?
Yeah, I think we need to repeal the health care plan and start over. What I would have liked to have seen done instead is to allow health insurance to be sold across state lines. I would like to have seen the health savings accounts actually increase when in fact they were cut in half. There were several additions that went into the health care plan that had nothing to do with health care. They included increasing the number of IRS agents, putting 1099 requirements on businesses, and those kind of things. And I think that there was a need, in fact, to correct these, but what I'd wish the Congress had done was placed a priority on helping get the economy back on track by encouraging private investment and private job creation. And I think they lost about an 18-month excellent opportunity whenever they actually pushed forward with Obamacare. It was very disappointing that they had to do the manipulations with the numbers and things that they did. Thank you.
Ms. Emerson.
I agree both with what Rick and Larry said, and think that you all made very good points, and that's why I voted twice against the health care bill. But I will say to Mr. Sowers that, number one, you can't have it both ways. You can't have told the Southeast Missourian 2 times that you supported the health care bill, once even before the anti-abortion language was in it, number one. Number two, the bill is a boondoggle for insurance companies and pharmaceutical companies, and they're going to make out like bandits. I voted against it. This bill has $500 billion of new taxes in it. It cuts Medicare by $500 billion, and it will destroy the ability of our employers and folks here in our district to be able to afford any kind of health care at all. It negatively impacts our hospitals. It negatively impacts our doctors who are going to stop taking Medicare patients. And it will make it very, very difficult now for the thousands of seniors in our congressional district who actually have Medicare Advantage.
All right, the next question will go to Mr. Van Dieven, and it's from Mr. Rust.
Mr. Van Dieven, what role can and should government play in the creation of jobs, specifically here in the 8th District?
Government is incapable of planning a robust economy or creating jobs. We do not have the luxury to nickel and dime the federal budget like the Republicans' new contract with America does in order to reduce spending. It's going to take big ideas to get this economy back on track. Here is the federal budget pie. 1/3 of it goes to defense, 1/3 goes to entitlements, and 1/3 goes to everything else. If you elect me, I will work to end the occupations in Iraq and Afghanistan and close the 700 U.S. military bases that are located in 130 countries around the globe. This will result in an annual $300 billion jolt to the economy. I also have the courage to phase out our single largest entitlement program, one that is unsustainable and will not be around for future generations. That is Social Security.
Okay, Mr. Bill, do you have a comment?
I'd just like to give a real small example. People are out that are private job creators, have no idea what the government is going to throw at them next. They don't know what the tax rates are, and they don't know what the new regulations are. They don't really know what's in the health bill. I'll give you a real quick example. I'll try to get it out. I'm president of a small insurance company in Gordonville, and we were required, in order to cover liability fraud, by the federal government to buy a software program so that we could report the 10 cases of liability that we had. It cost our company $4,000 to do that. It was a new requirement. You had to do it. We paid $4,000. 2 months later, we got a letter from the government that said if you had 500 or fewer claims, you didn't have to pay the $4,000. It's that indecision that this federal government brings out is what's preventing the job creation in our nation right now.
Ms. Emerson?
I would say the first thing that is impeding the creation of jobs is the uncertainty that our small businesses and all businesses are really feeling in the marketplace today. There's uncertainty over the impact of the health care law and how much it's going to cost businesses to not only comply with it, but then how much is it going to cost their bottom line. Number two, environmental regulations, the threat of cap and trade being imposed not necessarily by the Congress, but by the EPA when they released their draft regulations on January 2nd, 2011.